Thank you again for being here. Sorry I missed last week. Hopefully you're going to like today's webinar. I want to thank Brightbot for sponsoring today's and every webinar I do. I would like to remind you that throughout the presentations, your microphones are going to be muted, but at the end of the presentations, we are going to give some time for you to ask questions, which is my favorite part. Remember, this is based on my medical experience, but it doesn't replace medical consultation. If you have any questions that maybe you think about after the presentation, you can go to brightbot.com and record a video questions, and I or somebody else will record an answer for you. So let's begin. Okay, today we're going to be talking about menopause. Is it a disease or not? This is a very interesting subject. Nowadays, menopause has changed. In the past, it was considered something normal, and now everybody's talking about it. So people are not really sure if this is something that is supposed to be treated or is it something normal. Again, my name is Jaime Mesa. I'm a doctor. I'm a medical doctor. Basically, I treat and work with chronic diseases. So first of all, let's talk about numbers. Every woman needs to go through menopause. That is something unavoidable, and that is something that every woman should know. So this is something all of you are gonna go through. It occurs between ages 49 and 52. That depends on the country, but in the US, the average is 51.7, so almost 52 years old. Before age 40, it's considered premature or early menopause, or ovarian failure, premature ovarian failure. So that's the number we're used to know this is happening too early. So remember that, 40. And it's also important to note that only 20% of women in the US consult their doctors regarding perimenopausal symptoms. So it's 1 in 5. What is menopause? And I think there's a lot of confusion in the terms, and I'm going to be using certain terms and I want them to be clear. The first is menopause. First, menopause literally means the stop of the monthly cycle. So that means when there's no more menstruation. That's basically what it means. Medically, we talk about menopause after 12 months of not having a menstrual period. That's consecutive months, of course. So if there are 10 months, you're not having your period for 10 months, you're still not in your menopause. You have to wait 12 months. It is basically caused by the depletion of the follicles. As I explained in certain webinars before, women are born with a certain number of follicles which will produce and release one egg. So they're born with a specific number of eggs. When this number is depleted, there are no more eggs and follicles, then certain hormone levels begin to drop, and in response to that, some others begin to rise. So basically, estrogen levels drop, and in response to that, LSH and FSH, which are other hormones, they rise. And it is a normal part of every woman's life. So the other terms that I'm going to be using are premenopause and postmenopause. And there's something that is called perimenopause. Premenopause, of course, refers to the period before a woman actually gets the 12 months. And of course, postmenopause refers to the period of time after they had 12 consecutive months period. And the perimenopause is the period which includes the pre-menopause, the menopause, and the post-menopause. And usually that's the term we like more, perimenopause, because in all of these three periods, symptoms appear. So it's not really the menopause, it's the pre and the post, which we put all together in perimenopause, which means around the menopause. So what are these symptoms that we're talking about? And probably women know more about this. Of course, number one symptom is the hot flashes. That is 80% of women complain of hot flashes during premenopausal stage and post-menopause. Also, sleep disorders, either insomnia or simply hypersomnia, which is not so common but can be also present. Mood changes, this is very, very, very common. Sometimes it goes to depression, which is also very common, but not necessarily. It could be simply various mood changes, or just become aggressive. That's also something that happens. There are lots of gynecological symptoms related with menopause. Vaginal atrophy, which is not a symptom but a diagnosis, refers to the changes that occur in the vagina after and during perimenopausal period. So it manifests as dryness, a little bit more of sensitivity, and in sometimes it actually starts affecting the sexual relations, and maybe they become painful, or simply the libido diminishes because of this. So those are like the most common symptoms. There are more than 30, which include pain in breasts, loss of memory, loss of attention, and some others, but these are the most common. Then, what about irregular periods? Because I have a lot of patients who come to my office and they tell me, okay, I've been having irregular periods, so I think I'm on my menopause. So first, irregular periods can be caused by many different conditions, but of course, if you are near the age where menopause may occur, it might have to do with it, but you have to remember that this is a symptom of premenopause. So this is what happens before you actually stop having periods. So premenopause is a period of time that's before menopause, and it might start 4 or more years prior to the actual menopause. So probably that's what's happening. And that's what women are confusing with menopause itself. So it's actually the pre-menopause. When you suddenly start, your periods, your cycles begin to lengthen a little bit more. So basically it is because the hormonal changes start already, but they still have their last follicles and their last eggs to be released. So basically the cycle starts to lengthen a little bit, and then it might occur a little bit of spotting between periods, and each time they're longer and longer, and they skip more and more periods until they finally stop for an entire year. And basically that's what you get till your menopause. Of course, this is a lack of information. So because menopause only happens once after the 12th month, that's the menopause. Then the rest of the time it's post-menopause. And the most important thing that I would like you to remember about this explanation is that after the menopause, after 12 consecutive months of no periods, it's abnormal to have any kind of bleeding, even if it's mild, like a pinkish discharge, or blackish or brownish, or simply mild spotting. It is not normal at all. So if you are post menopause and you had any kind of bleeding, you should immediately go to your doctor. Not necessarily an emergency, but you should schedule an appointment, um, if you can, with gynecologist. It's better. These symptoms start, as I was telling you, 4 or more years before the menopause, and they last after the menopause about some more years. So many patients are very concerned and they ask me, will these symptoms last forever? The answer is no. This is a natural process, and for some women it's different. For some it takes more years. Some others actually do not suffer from any symptoms whatsoever. But for those of you who do, we have to understand that this whole perimenopausal period basically lasts 4 to 10 years. And I know that might sound like not very good news, but at least you know that it's going to stop uh, somewhere in time. So it suggests hanging there, because naturally the symptoms might will disappear. Another question that many of my patients ask me is, does a hysterectomy cause menopause? Well, it depends. The answer is no, but I will say it depends, because basically it depends of what surgery did you actually have. Hysterectomy itself only refers to the surgically removal of part or the entire uterus, as you see in the in the image here. You can see the different types of surgeries we have. But sometimes we do a salpingo-oophorectomy, which is a very strange name, which is the removal of the tubes and the ovaries together with the uterus. So if you had this type of surgery, then of course in this case, menopause will occur, because basically estrogens are produced mainly in the ovaries. So by removing the ovaries, an artificial menopause will happen. So of course, if you're too young, maybe that's one of the patients we might have to treat, depending on the age, of course, and the reason why you had the hysterectomy. Then, if I'm telling this is a natural thing to happen, part of the natural process, why do some women need treatment for it? Well, basically, treatment it's only for women who have severe symptoms of menopause, or who had a very early menopause. So probably if you had it at 39, even when it is still considered early, you have to weigh risk and benefit in this matter. But basically, if your life quality is affected severely, then you are a candidate for the treatment. And obviously, like I was saying, risk benefit. What risk versus what benefit? Well, I'm going to talk about that later on. But remember that only 20% of women suffer from severe symptoms, which makes them ask for treatment to their doctor. So it's not that really common to actually have it. So what treatments do we offer? Hormonal therapies, so replacement of estrogen, which is the hormone that is lower. We offer that. Also, certain medications of the families of antidepressants, but we don't use them for that. I mean, it might help a little bit if you're experiencing some depression because of this, but it's mainly because it helps with certain symptoms like hot flashes and the mood changes, of course. Clonidine also, which is as a certain way used for hypertension, it also blocks certain channels that might be able to help with the hot flashes in this case. Obviously, we do offer, and this is very, very common, the calcium and the vitamin D. Why? Because estrogens are believed to offer certain protective uh, benefits or roles, a protective role against certain things in women. First of all, cardiovascular events. That's why, in theory, women do not have the same risk of having cardiovascular problems as men, at least not until they are in their menopause. Then that risk is equal. And also, estrogens have a certain effect on the metabolism of calcium and how it is stored on the bones. So that's why after 40, we start recommending women to have calcium and vitamin D supplements, because this is one of the reasons of the high prevalence of osteoporosis. And also very used in, I think this is one of the best tools we have, are topical estrogens to directly apply them on the area which is affected, which is in this case, sorry, the vagina, because it helps for prevent the atrophy after the hormonal changes. Also, a question that is very important, which is also related to the treatment, is there any relation between hormonal therapy and cancer? Well, the answer is yes. There is relationship between hormonal replacement therapy and cancer. Mainly two types of cancer. Number one is breast cancer, and number two is endometrial cancer. We have to remember that certain breast cancers are very susceptible to hormonal input, so they grow faster with in the presence of certain hormones. That's why actually we, as I mentioned in the breast cancer webinar, we do measure the estrogen receptors in this types of cancer, so we can use medications that block this estrogens. So if you have risk of having breast cancer, or you have breast cancer already, and you start taking hormonal replacement, of course, that's going to make it worse. On the other hand, endometrial cancer, which I already talked about, we have to remember that it starts or it results from an imbalance of hormones. It's not actually the lack of a hormone or the excess of a hormone, it's just the imbalance, estrogen versus progesterone. So if you start taking one of them more than the other, that might make you susceptible to endometrial cancer. So that's why this kind of treatment, it's very controversial, or at least has to be taken with a lot of care, because, and considerations. Usually it's for a very short time, just to improve those symptoms and get you through the worst part of the perimenopausal period. And then we stop giving this medication so you can naturally leave the menopause. So thank you. I hope you liked it. And now I'm going to give some time for questions. So please go ahead.
Dr. Mason, what would happen if, say, for instance, you did not see your period for, or what condition would that be? If you did not see your period for the 12 months, and then all of a sudden the period came back again and lasted maybe another 2 or 3 years. In a case like that, would that be some sort of disorder?
Well, the strict answer is yes, of course. There's something that should have happened there to stop the cycles. I guess it depends on what age are we talking about, because if this was at age 40 or around 40 or older, then we might be have to do certain studies for endometrial cancer. This is not the typical presentation because usually in postmenopausal women, after the 12 months of not having periods, if you have any kinds of bleeding, it's very, very, very mild bleeding, not really like having again a period for 2 or 3 years. But I guess it could happen. Now, what is more likely that happen is that something caused your cycle to stop. Obviously, the most plausible explanation would be hormonal changes, either or anemia or blood conditions. Because as I always say, the body is very wise. If the body cannot spare blood, then the period and the whole cycle will stop. If there's no energy enough to do certain body functions, everything that's not necessary to live will stop, including the cycle. So when I talked about period abnormalities, I mentioned some conditions that might stop your cycle, which is exercise, not eating enough, anemia, severe stress. So maybe one of those conditions cause that problem. Obviously, this case has to be analyzed, but those might be some of the reasons.
Okay, thank you.
You're welcome.
Dr. Jaime, is it necessary to keep your uterus after you have gone through menopause?
Well, it's not necessary, of course. We say that as long as you have a uterus, you have the possibility of developing cancer. So some doctors, if they have the opportunity, they will remove it. Not that we do it just to remove it because, but if we have another condition that we might help by removing the uterus, we will do it. So it won't change if you have it or not. Obviously, the only thing that will change is that if you still have a uterus, you have the chance of developing endometrial cancer. So, well, that basically the function of the uterus is bearing children, and if you're not gonna do that anymore, then technically there's no reason for you to have it. I mean, you could spare your uterus if that's your choice, I guess.
Okay, thank you.
You're welcome.
Doctor.
Yes.
Doctor, are there any lifestyle changes that someone could make that would say lessen or reduce the severity of the symptoms?
Well, when you read about menopause, you'll start reading about the treatments, and you'll find lots of information: alternative medicines, acupuncture, yoga, tai chi, and all kinds of things. Of course, there's little evidence of some other things actually helping. Now, exercise, in this case, I think exercise always makes everything better because exercise requires certain hormonal changes or tune-up in your body. So I wouldn't say it will definitely remove all of your symptoms, but I do think it might improve certain symptoms, maybe hot flashes and certain pain. And of course, it will definitely help with the calcium, because if you do, especially if you exercise on the sun, you get more sun, more vitamin D, more calcium, more exercise, more hormonal input, and then you might improve a little bit your symptoms. That's something that I would definitely recommend to do. Yes.
How about drinking, smoking, that kind of thing? Does it matter, you think?
Oh, yes, definitely it matters. We know now and this is actually one of the subjects that has been studied the most, the risk factors for early menopause, and cigarette smoking. It's one of the most related risk factor for early menopause. So yeah, definitely. If you stop doing it, you definitely have better odds of not having menopause so early and probably not so bad.
Okay, thank you.
You're welcome.
Are there any diseases associated with menopause?
Are there any diseases associated with menopause? Was the question?
Yeah.
Yes and not. Obviously, like I was saying, after the estrogen levels drop, certain protective effects that they have on the body will wear off. For example, cardiovascular protective effects, and also the effect on the bone density. So we might say in a certain way that cardiovascular diseases and osteoporosis are related with menopause. Of course, if we compare men and women, we'll discover that actually that risk becomes equal. It's just that they were protected because they had more estrogen before. So well, that's the answer. I'm not really sure if it's okay to say they're related, but definitely they are. You might find out that after this period, these conditions in women rise a little bit more. So yes.
Dr. Mesa,
Yes.
does a woman typically follow the pattern of her mother when it comes to menopause?
Well, yeah, actually, my experience, I haven't read anything about it to be honest, but in my experience, they do in most cases. And not only that, but they do follow certain patterns around the persons they live with. Of course, that talking about the menstrual cycle, as you might hear, women living together, their cycles are they are similar. Then, of course, in family members, there's actually a little bit stronger relation because in a certain way, genetics might actually determine how many eggs will a woman have. So of course, that's something very similar from mother to daughter. So in many cases, it is not in every case, of course, but you'll see that your patients with some kind of early menopause, like I had it at 40, they'll tell you that their mothers had it at a similar age. So yes, there is a relation. Yes.
Okay, now you mentioned 40. I was going to ask you, if a woman is, you think, going through menopause or early menopause at the age of 40 and has not had any kids but want to have kids, what would you suggest that she does?
Well, normally for the diagnosis of menopause, we don't need any tests. Of course, for such case, we might need some hormonal levels to see actually if she is having an early menopause. But if she wants to have kids, then she would have to try to do in vitro fertilization, trying to save her last egg if she has it, and she might need to even undergo surgery. Now there's ovary transplant, so we can actually transplant the ovaries of someone else, and that might give you the opportunity to have children, but it's not a very easy and certainly not very cheap process. It's actually very expensive. So basically, with one study, you can know, with certain studies, you can know if she's actually going through menopause, and the only possibility is trying to save the last eggs she has, if she still has any.
Okay, thank you.
Okay.
Dr. Mesa, did you
Yes.
say that vitamin E helps with the hot flashes?
No, not really. But I was talking about vitamin D, but not really for the hot flashes. We usually use vitamin D and calcium because after menopause, the risk for osteoporosis increases. Other vitamins that we might use, well, vitamin E, we use it, but more for breast pain when women have like a certain condition of the fibrous tissue in the breast. We might use it, but not to relieve the hot flashes. For that, we use hormonal replacement therapy or certain medications of the family of the antidepressants, which are the serotonin selective um, reuptake inhibitors, which are the SSRI. It's a complicated name, but we have several medications that might help with that, not necessarily dealing with the hormones. Clonidine also helps with that, because what causes the hot flashes, it's the blood vessels in the face. They actually they grow, they dilate, so that creates the feeling of being hot and actually the redness in the face. So we use certain medications to stop that process from happening. Clonidine might be one of the medications that might help. Of course, that depends on the patient.
What if someone doesn't want to take the replacement therapy? What can they use?
Well, now there are certain other medications which the evidence is not very strong, like phytoestrogens, which it's very poor. Actually, I would say they don't work really good, but some people take it because it's very similar molecule to the hormone, but it's produced by plants. So they think if it's similar, but it's from plants, then maybe you can have it. It will work with you, but then your risk for cancer won't be so high. But in studies, they don't work so well. There are other medications that might work, like I was telling you, certain antidepressants, but I guess it depends on how severe are your symptoms and on you, on each patient. There are certain other medications, but we don't have that many for this, because we really don't know exactly what causes this whole symptoms. So I'm not really sure of what would you need in this case, of course.
Okay, thank you.
Okay.
Dr. Mesa, have you ever found cases whereby a female is going through menopause or has gone through menopause, but did not even know it because it did not affect them in any way abnormally, whereby they did not get hot flashes, no depression, nothing like that?
Definitely, definitely. And this is more common than what you think. I have many patients that are already postmenopausal, and they tell me, I didn't suffer from anything. My period simply stopped, and I never felt hot flashes, not mood changes. So I feel like I'm lucky, they say. But actually, it's more common. Like I was telling you, it's actually the opposite. Or the women that actually have symptoms are less than the ones who don't. Of course, everybody talks about the symptoms, so it becomes normal to think that every woman has it, but not really. Actually, it's very common to not feel anything.
Okay, all right. Thank you.
You're welcome.
I have a few questions. Can you hear me okay?
Yes. Speak up a little bit.
Is this better?
Yeah, definitely.
Great. First question is, someone earlier asked about if a mother has, when a mother goes through menopause, will her daughter experience the same thing? What happens if the mother experiences menopause as a result of having a hysterectomy? Is it likely that the daughter will then also experience menopause in a similar way as her mom, or is that irrelevant?
That's irrelevant. Of course, it might be coincidences, because usually the age where women have hysterectomies are around 40s also. So we're never going to be sure at what age will that woman have her natural menopause. So in some cases, there might be certain coincidences, like she underwent surgery when she was 42, and she was actually going to have it at 43. So she never knew, but her daughter didn't have surgery, and she got her menopause at 43. So she will say, "Oh, maybe I had the same at the same time, but it will only be a coincidence. It doesn't have any connection."
I'm not sure really how birth control works, but I think it has something to do with the hormones. And so, because you said it could be dangerous for a woman to have, the relationship of estrogen and progesterone, I think it was, off, would taking birth control pills affect that ratio of hormones?
Yes, we have different birth control pills. We have different amount and different types of hormones. And that's, I think, one of the reasons why now most birth control pills are a combination between estrogens and progesterone. There are few which only have estrogen, and of course, those might increase the risk of endometrial cancer. So now we try to use the ones that have a combination between both hormones, so they will basically maintain that balance even when you're taking hormones.
Thanks.
Okay.
Doctor,
Yes.
in say brief, like layman's terms, what is the actual mechanism that causes hot flashes?
Well, nobody knows. Nobody knows. We know how they happen, but we don't know why they happen. I'm not really sure if you get it. We know that somehow the blood vessels, especially in the face, receive the message to actually grow and like response we call vasodilation, which is basically grow. How to say I'm not really sure about the word, but they grow like in a response to heat, because when that happens, people start to sweat, and that's a mechanism to help us release some of the heat we might have. But for some reason, which we obviously suspect has to do with the other hormones that are rising, but for some reason this happens, that this message comes to those vessels to do this, which is not normal or shouldn't be normal, but we don't really know the exact reason why this happens. If we knew, probably we would be working on a better medication. So that's a great question. I guess that's the question that every doctor has on their minds, because that would be pretty helpful.
Thank you.
Conventional question whereby you see men may say they have hot flashes and they behave in a way that may be unconventional. Would be said that they're going through some sort of womanopause?
Well, now, and this is a new concept, now they're talking about the andropause, which refers to the testosterone and not the estrogen. We obviously know this is partially true because there is a stage in the man's life when testosterone begins to decrease. So obviously we have to have a similar reaction or similar symptoms, mood changes, libido changes, and also certain other conditions that begin to rise. So I'm not really sure about hot flashes. I don't think it's like a typical, but maybe it might be. I mean, you never know. But at least I know there is now something we call andropause. So yeah, we have something similar.
What's the name of it?
Andropause. Yes, ANDRO.
Okay, thank you.
You're welcome.
We need to share the wealth a little bit.
Oh yeah, definitely. Well, thank you everyone. Your questions were great. Remember, if you maybe have some questions after this, you can go into brightbot.com and record this video questions, maybe, I don't know, about andropause or something else. And hopefully I'll see you again in my next webinar next Tuesday. So have a great night.